Gulani is a local ophthalmologist and internationally renowned corneal surgeon who is here with us this morning. Good to have you here.
Good to have you, Bruce. Thank you very much.
Let's back into this. First of all, let's show people how the fungus manifests itself and what it would look like should a problem develop.
Absolutely. Fungus infections of the cornea, as we can see, be coming up on the screen shortly. It's an involvement of the front part of the eye.
Can we go ahead and pop up that first picture? If we could, the first still that we have of the actual eye infection. There you go.
Right here, you can look at the cornea, and the center has an opacity. Actually, it's an infiltrate, as we call it, which is fungal in origin. And this causes an infection enough that the patient's in severe pain, the vision's decreased, and obviously watering as symptoms. And once we treat this condition, as we go to the next picture.
This is the healed and treated eye. Okay, I'll tell you what, let's go ahead and use this model first. This is what a scarred cornea would look like.
Absolutely. Here's what a normal cornea would look like. The cornea is the front clear window of your eye. When this fungal infection heals successfully, even successful healing leads to scarring of the cornea. Scarring of the cornea until now had only one treatment, which is corneal transplants, which is pretty much an interventional surgery with a long, nearly a year of rehabilitation, and even then less than optimal vision. But now with laser technology, even the scars we can take care of and pretty much get back patients to vision.
But the bottom line is, even though those scars can heal and you can use laser surgery in order to take them off, this is a healthy eye now. You don't want to put yourself in a compromising position. All right, let's talk about the situation concerning Renew. It's essentially saline with some antifungal agents. So it's really perplexing that this would lead to a problem.
That is right, and that's why investigations are still on. They haven't yet found a direct correlation. Though, as you said the numbers correctly, 109 infections have been attributed by the CDC, of which 30 of them had the data. 26 of them had been using Renew. Now, the industry itself, along with CDC, is investigating to see if really that is a direct correlation.
And the problem actually goes much further, because there are a lot of people who say, okay, I've worn contact lenses all my life, and now I want to go to the next step and seek laser surgery. If they don't know they have a fungal infection, you can have complications in relation to that surgery that can lead to blindness.
Surely. And that is, again, everything that we've constantly taught about. A LASIK surgeon is always needed to be aware of the corneal anatomy and physiology. And a patient like this, we have sent out actually an advisory to a number of LASIK surgeons in the country where we are saying wait an additional week beyond contact lens wear for a patient before you proceed.
All right,
let's say you look for a brewing infection.
Let's talk about three of the things that we contact lens wearers can do in order to make sure that we ensure our eye health. Number one would be prevention.
Number one would be prevention, which is the most important. Prevention by using good hygiene, following the directions of your optometrist or your eye doctor where they've told you how to use your contact lenses. Also, rubbing and rinsing is better than just rinsing, just for the higher levels of clarity and cleanliness.
So you're saying that those solutions where they say just, put your contact lens in it overnight, you're really doing yourself a disservice?
In a way, yes. Actually, it works very effectively, but now that we have this outbreak, why not be a little more cautious?
Go the extra step. Point number two would be management.
Management, because if you see signs of infection, which are redness, pain, decreased vision, irritation in your eye, get to your eye doctor, at least call them, let them take a look.
And if a problem develops, visual rehabilitation is the key.
Again, visual rehabilitation, once you aggressively treat this condition, hopefully save the eye rather than lose the eye, then you end with a scar and then go in for treatment to get your vision back.
Now, have you seen any of these cases here in Jacksonville?
Yes, we have. We've been sent to quite a few cases by local doctors, and they both are successfully treated.
Dr. Gulani, thanks very much. Hey, if you want to know more about this eye fungal infection problem or ways to resolve it, if you've got an issue, you can contact the good doctor at the Gulani Vision Institute. It's 296-7393, or you can visit their website, GulaniVision.com. Doctor, thanks.